Hey there everyone, welcome back to the Blueprint Nursing YouTube channel for today's video. My name is Nicole and we're going to be reviewing a common antihypertensive medication, Metoprolol. Do you remember what drug class it's in? Let's see. Metoprolol is an antihypertensive medication in the beta blocker drug class. It's commonly used to treat angina, heart failure, hypertension, heart disease, and myocardial infarctions. So, how does it work? Well, metoprolol is a cardioselective beta blocker. This means that metoprolol selectively blocks the beta-1 receptors. Let's do a quick beta-1 versus beta-2 receptor review. Beta-adrenergic receptors are a part of the sympathetic nervous system. Beta-1 receptors are primarily located in the heart. Beta-2 receptors are located in smooth muscle tissue, like bronchioles of the lungs or blood vessels. And for this, we have a memory tool for you. B1, we have one heart. B2, we have two lungs for the bronchioles. Okay, back to how beta blockers work. Beta blockers block the effects of epinephrine in the heart, which then slows the heart rate and reduces the strength of the heart's contractions. These two effects combined lead to a decrease in blood pressure. Metoprolol is a cardioselective beta-1 blocker though, so it has a lesser effect on the beta-2 receptors. What clients would benefit from this selectivity? Clients with asthma, yeah. However, high doses can still have an effect on beta-2 receptors. Main takeaway? Metoprolol decreases blood pressure and heart rate because it blocks the beta-1 receptors in the heart. What side effects can clients on metoprolol expect to see? We would educate them to look out for decreased heart rate, bradycardia, low blood pressure, hypotension, fatigue, maybe even dizziness, gastrointestinal upset. We're looking at the classic nausea, vomiting, diarrhea combination here, and peripheral edema. Keep these in mind when we review the client education later. On to safety issues. We know that when there is a change in the client's circulation that we may need to assess for any adverse effects or safety concerns. Significant adverse effects to look out for include bradyarrhythmias, so a slow and irregular heart rhythm, bronchospasm, or masking of hypoglycemia symptoms. We'll also want to ensure that the client changes position slowly to decrease their risk of falling. Lastly, we do not want these clients to stop taking their metoprolol abruptly. Abrupt withdrawal symptoms include tachycardia, hypertension, or decreased blood flow to the heart, leading to ischemia. Let's move on to contraindications and interactions. Contraindications of metoprolol include heart block, hypotension, and bradycardia. Metoprolol should be used with caution in clients with liver or thyroid dysfunction, diabetes, COPD, or asthma. And interactions that we'll want to be on the lookout for would be SSRIs, MAOIs, alcohol, antihypertensives, anesthetics, and NSAIDs. We'll also want to be careful giving clients two medications that both cause a decrease in heart rate. For example, two different beta blockers or a beta blocker plus a calcium channel blocker like diltiazem. Okay, so we have a client that is taking metoprolol. What nursing interventions might we want to see for this client? Let's get into it. We want to check blood pressure and heart rate prior to administration. We don't want to give an antihypertensive to a client who has a low heart rate or blood pressure. After administering metoprolol, we'll monitor the client's heart rate and blood pressure to evaluate the effect that the metoprolol has. We should also be mindful of any lung sound changes, heart rhythm changes, and adverse effects. If you're thinking what I'm thinking, we need to mention our clients with diabetes. Since metoprolol can mask symptoms of hypoglycemia, remember to be vigilant about blood glucose testing. What if the client is experiencing symptoms of bradycardia, hypotension, or CNS effects like confusion or lethargy? Well, we would want to hold the medication and notify the provider. All right, time to talk about what we teach clients who are prescribed metoprolol. We'll want to mention that this medication should be taken as prescribed. Clients should not abruptly stop taking metoprolol because, do you remember? They would experience symptoms of withdrawal. Yeah. Clients should also change positions slowly. We'll teach clients to assess their heart rate and blood pressure before taking metoprolol, what parameters they should hold the dose for, and when to contact their provider. It will be important to talk to our clients with diabetes about being diligent about blood glucose checks and review symptoms of hypoglycemia. Teach the clients about side effects and adverse effects. Metoprolol can also affect mood and cause sexual dysfunction. The client should contact their provider for any adverse effects from metoprolol. Okay, let's try our hand at an NCLEX style question to wrap things up. A client has been prescribed metoprolol and was provided education by the nurse. Which of the following client statements would indicate a need for further teaching? Option 1. I can continue my diabetes management as ordered. Option 2. I should call my provider with any concern for adverse effects. Option 3. I will change positions slowly after taking metoprolol. Option 4. I won't need to taper down this medication before stopping. Pause here, review the options, and come back here when you've picked an answer. Ready? So one statement had a red flag for me. Option 4. I won't need to taper down this medication before stopping. But why? Well, remember, abrupt discontinuation of this medication can cause rebound hypertension, tachycardia, and ischemia. Great work, friends! Let's run through the other options real quick. Continuing current diabetic management is acceptable as there is no evidence of needing any adjustment to their treatment regimen. Calling the provider in regards to adverse effects is an acceptable client action. Lastly, changing positions slowly after taking metoprolol is a great safety precaution. You guys, we did it! That sums up our review on metoprolol. Remember to subscribe to our YouTube channel to catch our content review videos. Also, check out Blueprint Nursing's self-paced crash course and live study group options. See you next time!